Welcome back. You are listening to the Mario Mokondo Show on Salam Media. It is 12:36 on this Tuesday, and it is time for our Women's Health Tuesday segment. Today we are talking about pelvic inflammatory disease, an infection of the female reproductive organs. It is most often occurs when sexually transmitted bacteria spread from the female organs to your uterus, fallopian tubes, or ovaries. Joining me on the line is Dr. Tom Mokaya, a specialist obstetrician and gynecologist. Hello, Dr. Tom.
Hello.
How are you today, Dr. Tom?
No, I'm good. I hope you and your listeners are good.
I'm well. I hope they are well too. Thank you for joining me once again. So, Dr. Tom, PID, pelvic inflammatory disease, what exactly is it and what happens when you have PID?
Now, pelvic inflammatory disease is, to define it very simply, it's a disease of the pelvic organ. And in this particular instance, we are talking about the pelvis, which in this case involves when there's an infection in the fallopian tube and or inside the uterus and or the lining of the womb or in the cervix, the region we call the endocervix. Any infection around that area is called a pelvic inflammatory disease.
Mm-hmm.
And most of the time, this disease is caused by a bacteria. The commonest cause of bacteria is a gonococcal, caused by chlamydia, or it can be caused by chlamydia. So it can either be caused by Neisseria gonorrhea or it can be caused by chlamydia. And after the initial infection, one can get secondary bacterial infection, and the process can go on and on. So it's essentially a bacterial infection that involves those organs that I've already described.
Mm-hmm. What are the symptoms of pelvic inflammatory disease?
Now, pelvic inflammatory disease can broadly be divided into an acute infection or a chronic infection. An acute infection is an infection which starts, for the lack of a better word, abruptly, and then progresses. And it doesn't, if it's not treated, it will probably have symptoms which are less than a week. And the symptoms of an acute PID include abdominal pain in the lower abdomen, and commonly it's associated with a vaginal discharge. And most of the time, this vaginal discharge is profuse, and it can probably change in color to the normal color to probably more yellowish or even greenish. And it's also associated with fever, and depending on how it is, it can also develop into abdominal pain around the stomach. So it's essentially abdominal pain and a pelvic discharge.
Mm-hmm. So, doctor, since one can get this disease from having a sexually transmitted infection, can they get it without the STI?
Now, most of the infections that are caused that lead into a pelvic inflammatory disease are sexually transmitted. 99.9% will be because of sexual transmission. Very rarely, theoretically, one can be able to get it if, let's say, they've had a procedure in the uterus where there is, let's say, a D&C has been done, and then the D&C gets infected, and where bacteria is introduced during the D&C, and that can lead into an infection in the uterus or in the tubes. So there are instances where a PID can be caused by instances which are iatrogenic, that is caused by a procedure which has been done there and is not caused by sexual transmission.
What are the risk factors associated with PID?
Now, as you mentioned, PID is mainly sexually transmitted. So it is therefore going to be associated with unprotected sexual intercourse, or in instances where they are involved, where there are multiple sexual partners, or a partner who has one partner, but the partner has many other partners. So that is the biggest risk factor. And there are other factors which reduce the immunity, because if somebody's immunity is low, they are predisposed to getting infection. So if the immunity is low, they could get an infection. So any diseases like HIV, or patients who have immunosuppressants are more likely to contract any infection. And this particular case, PID, the PID profile is also included.
How is it diagnosed?
Now, the diagnosis, as I had mentioned before, one can either have an acute pelvic inflammatory disease or a chronic inflammatory disease. Now, if I may briefly mention the circumstances where one develops a chronic PID. Chronic PID mainly presents with chronic abdominal pain, what we call as chronic low abdominal pain, which is there for weeks and weeks. And it is most of the time because one had an acute infection which was not treated and progressed into a chronic PID. Now, acute PID is normally diagnosed by a history taking. One takes a history, the patient presents with low abdominal pain, they've got a vaginal discharge. Now, on examination, we will find that there is pain in the lower abdomen. And when we do a speculum, where we look into the cervix, we'll find that there's a lot of discharge coming out, which most of the time is purulent and offensive smelling. And then we take a swab from there and send it to the laboratory. Then they can be able to tell us what kind of bacteria it is that is causing the infection. That is the easiest way in which a PID can be diagnosed. And there are instances where the PID has gone, there are different stages of PID, where the PID has been there for a long time and it has developed an abscess in the fallopian tube. An abscess is a swelling in the fallopian tube which has passed. And that can be diagnosed by ultrasound.
Sure.
And in patients who have chronic PID, normally the diagnosis is made by laparoscopy, where we put a small camera into the womb, and when we look into the abdominal cavity, we find that they either have an abscess, that is a swelling in the fallopian tube, or they have a lot of scar tissue and they have a lot of adhesions.
So, doctor, please tell us that there is a treatment involved.
I know it sounds very scary. Now, the treatment of PID, especially acute PID, involves, once the diagnosis has been made, it involves antibiotics. Unfortunately, there is a whole spectrum of very effective antibiotics which are used. So in the absence of what we call as a microscopy and culture and sensitivity, which tells us the exact bacteria and the exact antibiotics we need to use, there is a profile which we call a triple therapy, which covers the three commonest bacteria that cause PID. And if one presents in time, it is possible to treat the infection completely. So the first form of treatment is antibiotics.
Yeah. And how long can one stay with PID? You did mention earlier that it can affect, it can grow abscesses if left untreated. So, how long can a person go without being treated?
Now, when one gets um, the PID, the infection, it goes through stages. And
Mm,
in the clinical aspect, we've graded it into four stages, where the first stage is where there's pain, profuse discharge. The second stage is where the infection now goes into the abdomen, and the lower abdomen is very painful. The third stage is where now that part that has developed goes into the abdominal cavity and causes pain not only in the lower abdomen, but
mm,
all around the abdomen, what we call as peritonitis. And the fourth stage is where now it gets very severe. It goes into the bloodstream and it affects all organs. And if it progresses like this, if it's not treated, it can actually be fatal, because it will now affect, not only will it affect the pelvic organs, it could go and affect the lungs, it can affect the brain, and at
mm,
times it even goes as far as affecting the joints. So one, if it is not treated, it can progress. And if it's not treated at all, it can actually progress, and it can become fatal. But once the diagnosis is made and is treated early, within 5 to 7 days, it's completely treated.
mm-hmm. And I ask this because I know there are many people who probably have the disease that just brush it off, take painkillers for the pain that they're experiencing, probably use intimate feminine wash, and get that's just basically to get rid of the smell and the pain, but they are not actually treating the problem.
But that is very true. The other cause that I mentioned of PID is what we call as chlamydia trachomatis. Unfortunately, with chlamydia, it may not give you, a very offensive discharge where you can't,
Mm,
you may ignore it. And as you correctly say, some patients will go and either douche or go and buy over the counter vaginal creams, and they'll be able to clear the, the bacteria that is in the vagina, because that's the only one you can be able to clean. Unfortunately for chlamydia, it grows very slowly, and one can be able to treat the discharge that has occurred, but the process of affecting the tubes continues. And if it continues within weeks or months, it now progresses into chronic pelvic inflammatory disease. And therefore, it will progress into giving chronic low abdominal pain. So, depending on which bacteria one has, and depending on how it's treated or mistreated, it can stay there and continue causing damage. And we find that quite a fair amount of people who try to fall pregnant, and they may not be able to fall pregnant because the tubes are blocked. If one goes into the history, you find that they may have had some form of discharge a couple of months or a couple of years ago, and they probably ignore it, or they didn't know that they need to see a medical professional to treat it, and then the tubes get blocked, and therefore they struggle to fall pregnant. So it can cause infertility.
mm. Yeah, very scary things, a lot that we don't know as women. Dr. Tom, thank you for always availing yourself to share this information with us. Please share your contact details and information for our viewers and listeners.
Thank you. Thank you. I think you have the information, so you can share it with them.
All right. Thank you and have a wonderful day.
All right. Thank you very much.
Right. That was Dr. Tom Mokaya, OBGYN, obstetrician and gynecologist. Yeah, guys, pelvic inflammatory disease is not a joke, especially if it's left untreated. Make sure that you get yourself checked out for it and don't brush it off. If you're experiencing pain, uh, don't just take something over the counter, a painkiller, and think that your problem is going to be solved just there and then. No, you probably need to go and get a diagnosis and some medical treatment of how you can go through it. Dr. Tom's contact number 082-782-9300. That's 082-782-9300. You are listening to the Mari Mukonda Show on Salam Media, and we will be right back.